Hey everyone, and welcome to Medical Terminology. Today, we're going to be covering Chapter 1, Introduction to Healthcare Terminology. Let's get started. We're going to begin with Lesson 1.1, Derivations and Rules for Building and Spelling Healthcare Terms. First, we'll state the source of most healthcare terms. Then, we'll use the rules given to build, spell, and pronounce healthcare terms. Decodable terms. Most terms are from Greek and Latin, and many have been used for thousands of years. Let's look at some examples. Try to say healthcare terminology without moving your tongue. Kinda difficult, right? We need and have needed our tongues to communicate throughout time. The word language means a collection of words and rules for combining and pronouncing them for the purpose of communication and is derived from the Latin lingua, for tongue. Notice the first term, bilingual. It means pertaining to two languages. Most of you already know that it refers to a person who can speak two languages, bi meaning two. The second term, sublingual, is a medical term. Sub means under. Think of like a submarine. And the ending "ul" means pertaining to. This medical term means pertaining to under the tongue. In Greek, the word part represents tongue is glosso. Notice that the English term glossary, meaning alphabetical list of terms with definition, has its root in a Greek term. The second term, glossitis, is a medical term meaning inflammation of the tongue. The suffix itis is a common ending that means inflammation. See how lingua and gloss are displayed in red. Those are your first word parts. These particular word parts are called word roots. By the end of our time together, you will have learned hundreds of them. Much of what we will be exploring is the process of decoding terms. You will learn to recognize the word parts, recall their meanings, and use your skills to assign definitions to the terms. Now, there are non-decodable terms. So, terminology is also composed of words that cannot be broken down into meaningful component parts. For these terms, you will simply have to remember the entire meaning. Cataract is derived from Greek meaning a waterfall. This was perhaps to describe the loss of sight as a closing of one's visual capacity. Nice, but not useful for a medical meaning. Our definition is a progressive opacification of the lens. Asthma comes from Greek also, and literally translates as panting. Can anyone see the connection between panting and the disease? Although this might make a little more sense, our definition would be a respiratory disorder characterized by recurring episodes of paroxysmal dyspnea. Dyspnea is our word for difficulty breathing. Let's discuss our terms for present and future conditions. First, we have diagnosis. We have the word parts dia and gnosis. Dia means through or complete, and gnosis means a state of knowledge. Literally, complete state of knowledge, a diagnosis, to us is the name of a disease or condition after a healthcare professional evaluates a patient's signs, symptoms, and history. Then we have prognosis. Pro, which means before or in front of, and gnosis, which still means state of knowledge. A prognosis is a state of knowledge ahead of time, which sounds a little odd until you realize it's a prediction of the future condition of a patient. Now let's discuss some terms that equate to our time and severity of a disease. So for acute, think of acu means sharp, as in acupuncture, and short. An acute form of disease begins suddenly and severely. For chronic, think of long-term, recurring. The combining form chrono literally means time. The chronic form of a disease is characterized by a long duration and a recurring nature. In medical terminology, an instrument to measure time is a chronometer, or like the watch you have on your wrist. Next, we're going to discuss the differences in our terms for complaints. Patients normally come to see a healthcare provider because something is wrong. These can be divided into two categories, signs and symptoms. Signs are objective. They can be seen and or measured. Examples are fevers, high blood pressure, and rashes. Symptoms, on the other hand, are subjective. They are experienced by the patient but cannot be seen or measured, such as I'm dizzy or I'm sick to my stomach. Those are examples of symptoms. Now for one of my favorite topics, eponyms. Eponyms are medical terms that carry a name of a person or a place associated with the term. Alzheimer's disease, for example, is named after German neurologist Alois Alzheimer. This disease is a progressive mental deterioration. Then we have Achilles tendon, which is the band of tissue that attaches the calf muscle to the heel bone. Achilles was a Greek hero during the Trojan War. Can you think of any others? Perhaps maybe you're thinking of Parkinson's disease or Lou Gehrig's disease. Fallopian tubes is also one, and there are many more. Notice the ending of this term eponym, nym. This is a Greek term for name. We'll meet many members of this family, such as homonyms, words that sound the same, like the words there and there. Acronyms, terms made from the initial letters of an abbreviation. Pseudonyms, pseudo we know means false, so these are false names, like an alias or our now familiar term eponym. Now let's talk about abbreviations and symbols. Abbreviations and symbols are short forms of terms used for the sake of convenience. They are commonly used in healthcare documentation, and many will be presented throughout the text. Abbreviations may be simple as IM for intramuscular. Intramuscular is pertaining to within the muscle. Or C2, which is the second cervical vertebra, which is also a bone in your neck. Can anyone tell me the meaning of the abbreviation IV? That's right, it's intravenous. Intravenous means pertaining to within a vein. Intra is our prefix, which we're going to get there in a minute, for within. Another type of abbreviation is an acronym, which is a term that can be pronounced from its abbreviated letters. So an example of this would be CABG, C-A-B-G, which stands for coronary artery bypass graft. We also have TURP, which stands for transurethral resection of the prostate. The symbols for male and female are recognizable, and the increase and decrease arrows are pretty easy to understand. But there is a danger. Because of the shortened form, they either share a meaning or appear to be similar to another term. For that reason, the Joint Commission, which is the organization that oversees accreditation of healthcare facilities throughout the U.S., has established a do not use list that includes abbreviations and symbols that should not be used as a part of their effort to promote patient safety. The Institute of Safe Medical Practice, Inc. has a more extensive list. Be aware that every healthcare facility should have an approved list of the abbreviations and symbols that the clinicians may use. The secret to terminology is to learn the code to translate thousands of medical terms. Decoding basics, most terms are composed of a combining form and a suffix. Combining form is the subject of the term, meaning what is the term about. It is composed of a word root and a combining vowel, which is usually O. An example would be glosso. Gloss is the word root, O is the combining vowel. Together, glosso is a combining form. Notice that the combining form has a slash after the word root and is followed by the vowel. The suffix is the ending of a term. It gives you information about the combining form. Is the term describing an anatomical structure, a disease, a diagnostic procedure, a treatment, or maybe something else? An example would be itis. Notice that the suffix begins with a hyphen. This lets the viewer know that this is not a complete term, that there needs to be more information before these letters to make it a complete term. A big part of the course is memorizing hundreds of those Greek and Latin word parts we talked about, for a very good reason. In order to get a working definition for a term, you can use this method and notice the rhythm and rhyme. Check the word parts, combining form, word root, suffixes. Assign meaning to each of the word parts. Then you're going to take the meaning of the suffix and put it before the meaning of the combining form or word root. Finally, you'll define the term. Let's try this out. So first we're going to check the word parts in the term. Here we have glossitis. Gloss is our word part, which we can see here in red, and itis is our suffix, which we can see in green. Next, let's assign meaning to those word parts. So gloss we know means tongue, and itis means inflammation or inflammation of. Next, we will reverse them. So we will put our suffix first, the meaning first, which gives us inflammation of tongue. And finally, we will define the term. Inflammation of the tongue is glossitis. You'll notice throughout the rest of these slides that colors in the slides will help you recognize word parts and use them to define terms. It's certainly a shift in the way most people view words. New word parts. Learning these 10 word parts will help you practice your decoding skills. You might want to use flashcards. Electronic ones are provided in the accompanying Evolve site, or you can make them using 3x5 index cards, or you can also purchase them already made. Research shows that you need to be exposed to a word at least 6 times to place it in your long-term memory. So let's go ahead and go over these. Let's start with the combining forms. We have arthro, which means a joint, gastro, which means the stomach. Keep in mind this is also an organ. Ophthalmo, which is the eye, otto, which is the ear, and rhino, which means the nose. Next, let's define the suffixes. First, we have algia. Algia means pain. Next, we have tomi, which is an incision. Scope, which is an instrument to visually examine. We'll see an exception, but more on that later. And then we have logi, which means the study of, and finally plasty, surgical repair. I do want to interject for a second and mention something that I have found extremely helpful for my students in the past, and that is word association. So anytime you see a word part and you can connect it with something you already know, it will help you with your recall that much quicker. I'll give you an example. So imagine you have a plaster wall and it has a crack on it, and you need to put more plaster up to repair the wall. That might help you remember that plasty is surgical repair. Might not. If you think of any, I encourage you to share that with your classmates, because you never know, what works for one might not work for everyone. Okay, let's put our decoding into action. Here, the patient complained of chronic gastralgia. First thing we need to do is check our word parts. Here you'll notice that the red is the word root and the green is the suffix. Next, we're going to assign their meaning to those word parts. So gastra means stomach and algia means pain. Our next step is to reverse them. Put that suffix first, that suffix meaning first. So we have pain and then the stomach. Our final step is to define it. So this is where we get to kind of fill in the blanks so that all flows well. So we have gastralgia, which means pain of the stomach. Excellent. You've translated your first term. Now you can take your knowledge of the difference between signs and symptoms and use it with your decoding skills to tell me what this complaint qualifies as. Is it a sign or a symptom? Yes, it's a symptom. Pain is not something that can be objectively measured or seen. Most terms are built according to 5 simple rules. You must know the difference between a consonant and a vowel. Yeah. A, E, I, O, U, and sometimes Y. Remember those? If you didn't, now's the time. Exceptions do exist though, but they will be noted when they arise. Building terms rule number 1. If the suffix starts with a vowel, a combining vowel is not needed to join the parts. For example, here we have combining form arthro and itis. Because itis is our suffix and it begins with I, which is a vowel, we do not need that combining vowel O. Kind of think of those vowels as the glue to hold the word's roots to the suffix. If the vowel already exists, you'd have too much glue. Building terms rule number 2. If the suffix starts with a consonant, a combining vowel is needed to join the 2 word parts together. Here we have arthro and plasty. Because plasty begins with the P, which is a consonant, we need that combining vowel O. Building terms rule number 3. The word root endocardi ends with an I. The suffix itis starts with an I, so no need for both. Endocardio is a combining form that is made up of 2 word parts itself. Endo is actually our last word part that we're going to learn about, which means within, but we're going to learn more on that later. Building terms rule number 4. If two or more combining forms are used in a term, the combining vowel is retained between the two regardless whether the second combining form is a vowel or a suffix. The O is dropped from entero when combined with a suffix because the suffix starts with a vowel. But the O is kept between gastro and entero because they are two combining forms. Does it matter that entero starts with a vowel? No. The vowel consonant issue only is important for suffixes. Building terms rule number 5. Sometimes, when two or more combining forms are used to make a term, special notice needs to be paid to the order in which the combining forms are joined. The normal route of the digestive system, from the esophagus, which is our word part esophago, to the stomach, word part is gastro, to the first part of the small intestines, the duodenum. Also, duodeno is our word part. Therefore, when we're building this term, we have to put it in the order that the digestive system flows. So here, that gives us esophago-gastro-duodenoscopy. Lesson 1.2, Introductory Word Bank and Plurals. We're going to use the rules given to change singular terms to their plural form, and we'll also recognize and recall an introductory word bank of prefixes, suffixes, and combining forms, and the respective meanings. Let's begin building your word bank. We're going to start with noun suffixes. Here we can see is. Hypodermis is the structure under the skin. Endocardium is the membrane within the heart. Cuticle is the little skin around your nail. Arteriole is the little artery, and venule is a little vein. Now let's look at some adjective suffixes. All of these mean pertaining to and are adjective endings. Their role is to describe something. So, cardiac is pertaining to the heart. We don't know exactly what, but we know it's pertaining to the heart. Digital is pertaining to a finger or toe. Valvular is pertaining to a valve. Mammary is pertaining to the breast. Hypodermic is pertaining to below the skin. Subcutaneous is also pertaining to below the skin. Why would those last two be so different but have the same meaning? That's right, one's Greek and one's Latin. Pathology suffixes. All this terminology is giving me cephalalgia. Cephalo means head and algia is the suffix for pain, so the term describes pain in the head or a headache. Hyperlipidemia is a blood condition of excessive fats. Agastria is a condition of no stomach. And tonsillitis is inflammation of the tonsils. These two suffixes look very similar, but be careful. Chondromalacia is a softening of the cartilage. Malacia means softening. And splenomegaly is the enlargement of the spleen. Megaly means enlargement. Think of something that's mega. Now, each of these suffixes is also interesting in that it can stand on its own as a term. So here we have hysteroptosis, which is drooping or prolapse of the uterus. Then we have arteriosclerosis, a hardening of the arteries. You'll often hear sclerosis, sclerosed, sclerotic. And then we have arteriostenosis. You may also hear stenosis on its own as it means narrowing. Therefore, arteriostenosis is a narrowing of the arteries. You will meet many more of these standalone terms as we move through the course. Now let's move on to some diagnostic suffixes. Mammography is the process of recording the breast. Graphy is a process of recording. Something that I've told my students in the past that helps is remember if there's a Y ending, it's usually because something's happening. Spirometry is the process of measuring breathing. Metry is measuring. And biopsy, which is the process of viewing live tissue. Opsy is the process of viewing. And then we have hysteroscopy, which is the process of viewing the uterus. Therapeutic suffixes. Gastrectomy is a removal or resection, they mean about the same, of the stomach. So ectomy is surgical removal. Rhinoplasty is surgical repair of the nose, sometimes also means a cosmetic repair of the nose, something that insurance rarely covers. Therefore, remember that plasty is surgical repair. Then we have a colostomy, which is a new opening of the large intestine. Colo is colon, and stomy is that creation of the new opening. Next we have osteotomy, and it is an incision of the bone. Tomy is our suffix for incision into. Then finally we have lithotripsy, which is crushing of a stone. Litho is our word part for stone, and tripsy means crushing. An electrocardiograph is an instrument to record the electrical activity of the heart. The record that it makes is an electrocardiogram. Think of Instagram being a picture. It's the product of the graph. You may have seen the abbreviation ECG or EKG. Those are in relation to electrocardiogram or electrocardiography. A thermometer is an instrument to measure heat or temperature. An ophthalmoscope is an instrument used to view the eye. An instrument to cut bone is an osteotome, which is also known as a bone knife. So tome is an instrument used to cut. A machine to crush stones is a lithotripter. An instrument to crush stones is a lithotrite. Let's look at some specialties and specialist suffixes. So the study of newborns is neonatology. One who specializes in the study of the mind is psychologists. A teeth or tooth specialist is a dentist. One who records many aspects of sleep is a polysomnographer. The process of treatment of the mind is psychiatry. One who specializes in treatment of the mind is a psychiatrist. The treatment of children is pediatrics. The one who specializes in treatment of children is a pediatrician. Make sure to pay attention and know the difference between these endings. Now let's talk about our last word part, prefixes. They come before a term or at the beginning of a term. Prefixes modify a medical term indicating absence, location, number, quantity, or state. They can also indicate color. This is very important to remember for prefixes. Prefixes are attached directly to the beginning of the term. No combining vowel is needed to attach these. Please remember that. Prefixes get no combining vowel. They may have more than one meaning. Every once in a while, prefixes have two different meanings. You will be warned, so don't worry. Let's look at a few prefixes. Pertaining to not breathing is the definition for the term apneic. As in many definitions, this does not give you the entire story. Apnea, which is a noun, is a condition of temporary lack of breathing. Then we have anophthalmia, which means condition of no eye. Then we have antiversion, which is the process of turning forward. Then we have antibacterial, which is pertaining to against bacteria, like the wipes you may use to clean. Here we have dys for dystrophy, which is a condition of abnormal nourishment. Then endoscopy, which is the process of viewing within. Endo means within. Epigastric means pertaining to above the stomach. Epi means upon or over or above. Next we have two that can get confusing, so make sure you understand the difference between hyper and hypo. They look very similar but are very different. Hyperglycemia is a blood condition of excessive sugar. Hyper is that excessive part. Glyc is sugar and emia is blood condition. Remember, we put that blood condition, that suffix first, so it's blood condition of excessive sugar. Then we have hypoglossal, which is pertaining to below the tongue. Again, we remember that all is our suffix for pertaining to. And then we have hypo. Hypo means below or less than. And then glosso or gloss is tongue. Therefore, we have pertaining to below the tongue. Here's two terms that are easily confused. So I really stress that you put these on flashcards and make sure that you study them. Remember, just because you make a flashcard doesn't mean it's going to help. You actually got to use them. So again, these appear very similar. However, intervertebral means pertaining between two backbones. Inter means between. One thing I stress in medical terminology is that if you can find word association to help you with your recall, you are going to excel far beyond what you thought possible. An example, intervertebral. Enter. I had a student in the past who said it sounds like enter, enter between the doorway, enter between the doors. Enter means between. Then we have intra. Intra means within. Intradermal means pertaining to within the skin. Now all of these prefixes look very similar but also have different meanings. So first we have para and par, which both mean abnormal or sometimes near. Then we have paraphilia, which is an abnormal attraction to something. An example would be like pedophilia or dendrophilia. Percutaneous means pertaining to through the skin. Pericardium is the membrane surrounding the heart. Peri means around or surrounding. Then we have prenatal, which means pertaining to before the birth. Pre means before. Finally, we have poly, post, and sub. Polyneuritis is inflammation of many nerves. Remember polysomnographer? Poly means many. Then we have postictal, which is pertaining to after a seizure. Post is our prefix here, and it means after. Then we have subhepatic, which is pertaining to below the liver. Sub means below. Remember submarine? These singular and plural endings are the result of Greek and Latin origins of our terminology. For the singulars, if the term ends in the bolded letters, drop them and add the bolded letters in the plural column. Vertebra, which is a backbone, goes to vertebrae. Then arthrosis, which is an abnormal condition of the joint, goes to arthroses. Then we have appendix, usually refers to the addition, as in the vermiform appendix, that hangs off the first part of the large intestine. Appendix goes to appendices. Hey, this is editing me. I realized I completely skipped arthritis to arthritides. Back to the list. Then we have a phalanx, which is a bone in the finger or toe. Phalanx goes to phalanges. Then we have the endocardium, which is the membrane that lines the heart. Endocardium goes to endocardia. Then we have digitus, which is a finger or toe. Digitus goes to digiti. And finally, we have therapy, which is another name for treatment. Therapy becomes therapies. Now we're going to have pronunciation of some unusual letter combinations. Many of these terms just plain look weird, but you will need to be able to pronounce them. Your text will give you pronunciation for each one, but beware of some general rules. EU has a sound like the word you. Our word here is euthyroid, which means good or normal thyroid gland. Next we have PH as an F sound. Again, a phalanx is a finger or a toe. We have the N sound, such as pneumonitis, which is inflammation of the lungs. There is a time, however, where this rule can change. The PN makes the N sound only if it's at the beginning of a term. If the PN is in the middle of the term, you will pronounce the P and then the N, such as in apnea. You do your P, then the N. PS has a S sound, like in psychology, which is the study of the mind. Then we have PT, which has a T sound, such as ptosis, is a drooping or sagging. This, like the PN sound, is similar to where when the PT is at the beginning of the term, you're going to have a T sound. If the PT is within a term, you're going to pronounce the P, then the T, as in blepharoptosis. You have your P, then your T. And then we have RH and RRH, which have an R sound, such as rhinitis, which is an inflammation of the nose. Finally, we have X, which has a Z sound. Xeroderma is a condition of dry skin. Think of Xerox, which got its name from using dry ink. Now that you've made it through the first chapter, you need to think of what the majority of these terms represent. In general, they fall into one of these four categories. It's important for you to recognize what the terms represent. Are they representing anatomy and physiology? Are they pathology, which is a disease or disorder? Are they a diagnostic procedure, such as a test? Or is it therapeutic intervention, such as a treatment? Well, everybody, that's all I have for you today. Thank you so much for joining me, and I will see you on our next chapter.